welcome. We are back with our conclusion of scoliosis. And we're on call again, but so far so good. But first, our disclaimer.
We are sharing our own personal opinions on pediatric care. Always talk to your own pediatric caregiver about your child. Pediatric caregivers should always consult expert guidelines and consider their own community's standards of care.
Okay, Maddie, ready? I've got some things in the news to go over. And the first one is an article from just a week ago in our news journal in Delaware. It includes two physicians we know. One of them, Matt Gotthold.
And the other one, Rob Walter.
Yay.
Yeah, I got a little press time there, buddy.
Yep, and it all started with our frustration about not being able to get home phototherapy blankets for our newborn babies. It's called the Disappearing Billy Blankets. It's not a Harry Potter mystery. It's a home care product that some doctors say they can't find. And I got to say, when they put in the Harry Potter part, I was quite happy. But basically, it comes down to that we, for decades, have done home phototherapy with kids with mild jaundice that need treatment but don't need to go into the hospital, often with a visiting nurse coming each day to make sure that they're breastfeeding okay, checking the weight, and all of a sudden, they weren't available. And it came down to, which is not a surprise, that the rental companies that have the blankets were not getting reimbursed well. So they stopped carrying the blankets. And in this case of one of our patients who was highlighted, the child would have been at home for $75 a day, but had to be admitted for overnight, and the cost was $8,000.
Yeah, it's unconscionable on so many different levels. And we have tried to appeal to the other powers that be in our community in terms of local hospitals, et cetera. And of course, hospitals have a little different view on this. You know, if I were to be a skeptic, I would say that, perhaps the increasing admission rates is beneficial to them. But I also have to wonder whether some of this protocol is based on the fact that the kids who get admitted to the hospital are indeed the ones with the sky-high bilirubins. And we are completely fine with that.
Some kids have to be in the hospital.
Absolutely. But the fact that we no longer have this tool, this really essential tool to, number one, keep children out of the hospital and keep them at home, and number two, safely and effectively attack what is a problem in a lot of newborns in the comfort of their own home, is really frustrating to us. I mean, it makes me want to spit, Rob. You don't want that.
And I love the power of the press, and I was very appreciative that Meredith Newman, who wrote the article, took the interest to highlight it. And I think she'd been balanced. She got some quotes from the hospital and such, but I'd like to see if anything comes from it. Blue Cross Blue Shield said they never heard of it before,
right?
Although I know people who have called them about it. So I'm hoping that out of this we'll be able to get back to where we were, because to me it's an example of healthcare going backwards, especially in an age where we're trying to be smart with our healthcare dollars. This is, to me, is a no-brainer.
Oh, it's across the board win-win-win, especially I think if I were an insurance administrator and I looked at the fact that, oh, hey, listen, would I rather reimburse the hospital $8,000 or would I rather reimburse the local durable medical equipment company $75? Duh.
Yep. And, speaking of this, since it kind of does connected somewhat to breastfeeding, since a lot of these babies are breastfed babies, and we certainly support that.
Right.
Just to mention that our local hospital is piloting a trial of cross-training their regular nurses more in breastfeeding support, which is wonderful. But part of that is they no longer have automatic lactation consults for all first-time moms, which I don't know about you. I saw a mom this morning. I think, why wouldn't you get all first-time moms? I don't care to necessarily jump in to see what's data-driven. Everything is data-driven now. This kind of is just the smell test. I mean, it's a new mom, and she's anxious. And even if the moms have anxiety, it's still not an automatic. And talking to the nurses, they feel that it should be. And one nurse I talked to who was having a baby soon said, I won't be able to get one. And I said to them, talk to your pediatrician. Tell them to put the order in.
Absolutely.
If we put the order in, it'll get done. So I just think this is just, on its face, a ridiculous trial to look and seeing to cut back on lactation consults for the first-time moms.
Yeah, it's funny because when we both were initially in practice and seeing babies at the hospital, we did actually have to request a lactation consult. There were only, I think, one or two lactation specialists at the hospital. Right? You remember Kloppy?
I remember Kloppy.
Yeah,
she was great.
Kloppy was excellent.
Yeah. I don't know if her name was Kloppy. We just called her Kloppy.
Everybody called her Kloppy. But Shout out to Kloppy. When it came down to the years progressing, eventually the hospital rolled into having lactation consultants who were clearly very available and numerous and saw all of the first-time moms. So why we would want to go backward to this, like I said, is mind-boggling to me. I know that first-time mom who has questions that she doesn't even know that she has, which you and I find in our offices every day across the board in terms of topics, but especially with breastfeeding. It is so beneficial to have somebody involved from the jump.
All right, and our perinatal nurses are wonderful, and I'm glad they're going to get more training, but they already have a million different jobs to do. And even they say themselves, they're not going to be as good as a lactation consult,
right?
As a lactation consultant who's done thousands of hours doing it. So I wouldn't be surprised if at the end of it they say, hey, the data shows that there's equivalent in long-term breastfeeding and there's no change. And I'm going to say, I don't care. These new moms should get a lactation consult.
Sometimes there's data and sometimes there's common sense.
Amen. Okay, just in my pile of things I have here, a Delaware-centric thing that Delaware is trying to get the EPA to crack down on neighboring states because we have some of the worst air pollution in Delaware, and it's mostly coming from coal-fired plants in Pennsylvania and West Virginia. And it's with asthma issues and the other things that we see. I say, yes, we need to get our air. It's not fair that we have to suffer for other states.
It's like blowing your leaves into the neighbor's yard, right? Inadvertently, but nonetheless.
Exactly. And just got to mention as a follow-up that there was a bill in Delaware to legalize recreational marijuana, and it did go down for now, despite a lot of money being poured into it. So we talked about it before, but I'm glad. I know that Jersey's going to be doing it pretty soon. And again, it'll mean more pot, more in the high schools, even more than now in colleges, middle school, edibles, and it's terrible for young growing brains.
Yep.
Here's from Pediatric News. It talks about a study that showed that 1 in 3 children aged 0 to 3 showed moderate to severe signs of internet dependence in a study of over 600 parents. With surveys, over 2/3 showed at least mild signs of digital dependence, according to the researchers. Surprised?
Holy moly! I'm not surprised.
I know,
but I see it. See this every day in my practice, and I still say, "Holy moly!"
0 to 3. Now, having said that, I will talk to some parents about. There's some apps that are for shapes and colors and numbers, and you do it for 10 or 15 minutes. And the world runs on computers, and I just wouldn't think that that's what they're talking about. But it is scary because that's fueling everything as we talked about.
And how many times have you heard as a parent passes the child their iPhone, it's the only thing that calms him down. If I had a nickel for every time I heard that.
It's the only way he'll eat at dinner is to watch a movie. So,
and someday we'll talk about associations.
We will. And then the other thing is, every single teen visit, I'm like, where do you plug your phone at night? And it's always next to the bed. And I say, get it out of the room. And the teens just get really mad. But all right, another thing that came out just a few months ago, that the FDA approved Truvada for PrEP in teenagers. So we did half an episode on that. And as we said, it wasn't approved by the FDA for teenagers. And now it is.
Nice.
A listener contacted us just to say in our penis episode, when we talked about testicular pain, he wanted us to make sure we mentioned testicular pain from compression shorts from biking.
Ooh, good one.
I know. I didn't think of that, but it is real. So make sure those compression shorts are not too tight.
Yeah.
Another Delaware-centric. The Delaware legislature passed a law banning the disgusting and dangerous practice of forcing children to undergo so-called conversion therapy designed to change an individual's sexual orientation.
Thank God.
Remember Dr. Oz? We're gonna do our Dr. Oz rant because he had that in an episode. It's just awful. And Sugar Smacks. Do you like Sugar Smacks? Yeah, you didn't eat sugary food when you were younger. I ate sugary cereal when you were younger.
We weren't allowed to.
Oh, we did. So just that they banned Honey Smacks, and I was like, "What is Honey Smacks?" But it's Sugar Smacks. They banned it because of salmonella. So all you Sugar Smacks, Honey Smacks people out there, don't eat it.
Like banned it forever, or just
I don't know.
Took it off the shelves
until they get out of the
I didn't even know it
salmonella.
existed.
Yes.
So,
and we were just talking about smartphones and such, and we have talked before about gaming as like a $50 billion industry.
Right.
And front page of the paper a few weeks ago in Delaware is that 2 of the world's best players of esports online gaming are from Delaware, including a 19-year-old from Lewis who recently won $150,000 in an online game, and his biggest world competition is another Delaware youth from Townsend, whose name is Dominique Sonic Fox McLean. And the first winner of the $150,000 was Ryan Dragon Walker. So they've got those names.
Oh, they got names.
Those nicknames.
Yeah.
So anyway,
cool. Delaware overachieving, even in video games.
In gaming. And lastly, I thought you'd find this amusing. There's a big article about Gettysburg, Pennsylvania. Have you been to Gettysburg?
I only driven through.
I'm so I can't believe you haven't. I haven't either.
Yeah,
Like,
it's
we
pretty
love
pathetic.
History and stuff.
Take
we
a field
haven't.
trip.
But
Yeah.
if you go, there is in the Gettysburg Museum a new display called Civil War Tales, and this features dioramas to scale, historically accurately showing the battles of Gettysburg and other Civil War battles in different camps, except for one small detail. You know what that is? Every figure, every soldier in the dioramas of the Civil War battle are cats.
Oh God. That's actually a great reason not to go to Gettysburg.
You see, I'm the opposite. I'm like, I don't love cats that much. I haven't been there, but if I'm in Gettysburg, I'm going to see those cats.
I guess you're right.
That sounds cool.
That's freaky enough to be cool.
All right, we'll be right back. Okay, we are back to wrap up scoliosis. All right, Matt. So when should you refer a patient for scoliosis? Officially, if the scoliometer measurement's greater than 7 or greater than 5 degrees and a child is overweight. But as we said, we really don't use this. Number 2, if a Cobb angle is 20 to 29 degrees or more in a premenarchal girl or any boy at or before 12 to 14 years of age, or any Cobb angle above 30 degrees. And I find these suggestions to be well and good, but I'm going to refer every premenarchal girl or young man who has a Cobb angle over about 15 degrees to orthopedics. And really, if the curve looks bad or has a good amount of rotation or a lot of parental anxiety, I'll refer these skeletally immature kids earlier and sometimes even let orthopedics do the imaging if the parents would rather. Now, in the low-risk postmenarchal girls or boy 15 or older, we can just watch, but I'm very conservative to having to see orthopedics if there's a lot of parental anxiety. Having said all that, if we see a very mild curve, we may not even get an x-ray, right? We may just watch them and see them every 6 months or so till they get out of puberty, if there's no worrisome history or any worrisome physical findings.
All true. Okay, gang. Now what you've been waiting for all along, scoliosis treatment. Deciding on treatment versus just observation, if and when to brace, the role of exercises, and whether or not to do surgery all depends, to a large extent, on how the orthopedic surgeon feels about the likelihood that the current degree of scoliosis will get significantly worse. This again greatly depends on how much growth the adolescent appears to have. The scoliosis curves will progress in 2/3 of skeletally immature patients until they stop growing. Remember, these patients, mostly girls, may need many spine x-rays over the years, and the examiner usually only needs a lateral view on the first x-ray series. And again, consider the option of EOS to reduce the radiation load. We generally expect a worsening of the scoliosis if the child is under 12 years of age and for girls who haven't had a period yet. Both of these situations usually correlate to a RISR 1 stage. We also anticipate worsening if the initial curve is greater than 20 degrees or if the child has a double thoracic curve.
Another way of predicting how much worse the scoliosis may get was the controversial genetic test, or AISPT, or ScoliScore, which used a buccal cheek swab test to look for 53 genetic markers, which may indicate the risk of scoliosis progression. It was expensive, over $3,000, and really only for specific patients, 9 to 13-year-old girls with curves from 9 to 25 degrees. This test has really fallen out of use since 2 more recent studies show it was not really reliable and, again, really expensive. I've been told that chiropractors are still trying to promote this test to target scoliosis. My bias is that some chiropractors really depend on the fact that about half of patients with scoliosis will not get worse even if you do nothing. And really, for most of these kids seeing a chiropractor for scoliosis, they're getting nothing. I try to keep an open mind about chiropractors, and I think for musculoskeletal complaints and older teens and young adults that are not responding to traditional physical therapy and orthopedic intervention, there may be a role, but otherwise, I'm skeptical. What do you think, Matt?
I fall pretty much the same place you do, Rob. I think there's a role for chiropractic. I think that it's, manipulation can be helpful in the proper context and with the proper age groups, but I'm really leery about some of the things that some chiropractors claim to be able to facilitate or cure.
All right, especially the whole part about getting a free x-ray, and every time they get an x-ray in everybody, they're going to find chronic changes because as we live, there are chronic changes in our bones, and that doesn't mean they need to be treated. And I also get nervous when there seems to be no endpoint, that a patient's going to see a chiropractor multiple times a week and they're told they need to do this ad infinitum.
Yeah.
I also really shy away from chiropractors who want to adjust in the delivery room. And I've seen a couple of bad outcomes in my career from chiropractic manipulation in young babies. And there's a subset of chiropractors called the International Association of Chiropractors that claim that chiropractic cures work for infectious disease like ear infections, and also have claimed that chiropractic care is better than vaccinations in preventing childhood diseases, which is nuts.
That's nuts!
Nuts! And this group also invited Andrew Wakefield, he of the made-up measles data, to insinuate that it caused autism. I was stripped of my medical license, Andrew Wakefield, and he was the keynote speaker at their national meeting a few years ago. So that says it all. But to be clear, we've both seen teens and young adults get better with chiropractic treatment after not improving with traditional treatment, and we keep an open mind about it as long as it seems to be reasonable.
Now, the goal for treatment, as far as the orthopedic surgeons are concerned, is to keep the Cobb angle at less than 40 degrees. The treatment of scoliosis is an art as much as it is a science. In fact, a lot of what we do is that, isn't it, Rob?
Well, I do.
Yeah. maybe elementary school art for you.
Yeah.
Treatment options include observation only, along with observation and an exercise program, like the Schroth exercises. Beyond that, there's bracing and or surgery. The Schroth method started in Europe with adults with scoliosis and then filtered down to adolescents. It includes customized scoliosis-specific exercise therapy with the goals of improving balance and posture and of lengthening the spine. It also includes corrective breathing into the scoliosis-affected areas. There are not many Schroth-certified therapists around, but we're fortunate to have 4 or 5 here in our area.
And I've not found great data about how much this type of therapy helps, but it seems to be a good supplement to bracing, although it does not really replace bracing. It complements it, and it has been used especially in Europe with their common brace, which is called the Rigaud-Chenot brace, and it also may be helpful with just the most mild curves. In general, though, talking to orthopedic surgeons, any exercise that increases your core strength will be helpful to kids and adults with scoliosis.
Once again, scoliosis treatment rules are as follows. If the Cobb angle is less than 20 degrees and the patient is skeletally immature, just observe. If the angle is 20 to 29 degrees and the patient is skeletally immature, the practitioner can either observe or brace, with the consideration for bracing, especially for those over 25 degrees. When the curve is 30 to 40 degrees and the patient is skeletally immature, almost all orthopedists recommend bracing. At 40 to 49 degrees and skeletally immature, it's either bracing or surgery. And if the Cobb angle is over 50 degrees, surgery is strongly considered, no matter what the skeletal maturity.
Okay, now we're going to start talking about bracing and surgery, but I have to mention that I've talked to a few really good pediatric orthopedic surgeons who make the point that perhaps no one with adolescent idiopathic scoliosis really needs any treatment at all. Some of these orthopedists say that treatment is really purely cosmetic and that there's no great evidence that it reduces later pain or other problems. The type of significant breathing problems that Matt and I mentioned that are caused by restrictive lung disease in severe scoliosis is typically just not going to happen from simple adolescent idiopathic scoliosis, although that's always pushed as a reason to treat. Adolescent idiopathic scoliosis will not kill you. However, I don't think we want to dismiss the impact of the cosmetic deformity, especially those with significant asymmetry and bulging on one side of the back. And I do think it's hard to predict who may have more pain later on. Still, I was a bit taken aback to hear an orthopedic surgeon say that maybe there's no great evidence on most of these patients, even with severe scoliosis, to treat them at all. Okay, Matt, let's talk about spinal curves in the literature and popular culture, and specifically hunchbacks. All right, who's the most famous hunchback of all, Matt?
That would be Quasimodo.
I knew you'd get that.
Yeah, man. Victor Hugo.
That's from watching
Who also wrote my favorite novel.
I don't know.
Classic, Les Miserables.
You love Les Miserables.
I love Les Miserables.
So you know that Hunchback of Notre Dame from watching the Disney movie.
Yeah.
That's big.
and wasn't it Bela Lugosi who had I think he was a hunchback in like a black and white film. It was on all the time on weekends.
Either him or Lon Chaney.
Yeah,
they
one
did
of
all
the
the
two.
other ones.
Yep.
So yes, the Hunchback of Notre Dame. Hunchback, though, really means the kyphosis, which is the forward curving with a hump, and not the side-to-side curvature that we see with adolescent idiopathic scoliosis. Now, Quasimodo, according to the book, had this condition from birth, so it was likely a structural vertebral abnormality, perhaps part of a syndrome. As one ages, with arthritis and osteoarthritis and degenerative changes, you can get a severe kyphosis or hunchback in these older people. This was classically known as a dowager hump in older women who likely also had osteoporosis. That's one of the reasons we keep pushing lots of vitamin D and calcium early on in kids to prevent this kind of problem, as well as others late in life. And for teens, again, the most common cause of severe kyphosis is that frustrating Sherman's disease. All right, Matt, can you name some other famous hunchbacks in popular literature or movies? It's tough. Igor from Frankenstein.
Or Igor from Young Frankenstein. Yep. I don't know.
Okay, I had to look something. So Gru from Despicable Me.
Oh, yeah.
And, of course, Riff Raff from the Rocky Horror Picture Show. Did they show that movie down in the Pine Barrens? Did they have
I think they
have
did.
a movie theater down there?
That wasn't really my scene in high school or college, so yeah, I stayed away from it.
I saw it once at midnight at the Biograph in Chicago's Lincoln Park, which is where who was shot to death?
One of those gangsters.
Right, John Dillinger. It was a cool. I don't think it's a movie theater anymore, but it was cool. And then also Lumpy Adams from the Addams Family. Did you love the Addams Family?
I did. I think I like the Munsters better.
Uncle Fester, cousin.
Uncle Fester's
yeah,
classic.
I love the Munsters
Yep.
too. Do you know the Addams Family song? They're creepy and they're kooky, mysterious and ooky. They're all together ooky, the Addams Family. Their house is a museum where people come to see 'em. They really are a scream. The Addams Family. Doodle-doo. Nate. Doodle-doo. Sweet. Doodle-doo. 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 Petite. And lastly, of course, who can forget Tom from Harry Potter, the innkeeper of the Leaky Cauldron in Diagon Alley, which I might go to when I'm at Disney next week.
And I won't when I'm at Disney next week.
And I actually scored tickets and saw it on Broadway, and it was great. It was part Harry Potter, part magic show, and part really choreography like a dance show.
How I know
and you won't be going. It was so
somehow
good.
insinuate Harry Potter into this episode. Sneaky, man. Sneaky.
And I have to end our part about hunchbacks with probably the most famous literary hunchback of all time, Richard III from Shakespeare. And you know there's been a lot of late-breaking news about Richard III?
I had seen something written,
Yes.
although I would still argue that Quasi is the most famous one.
Well,
But anyway,
it's Shakespeare.
what's up
who
with
may be-
Richard?
Shakespeare, who may have been St. Francis Bacon, but that's another story. But King Richard III, who was described as a deformed hunchback by William Shakespeare about 100 years after the king's death at the Battle of the Roses, and it turns out that Shakespeare got it all wrong. Now, King Richard ruled from 1483 to 1485, and his corpse and skeleton was actually recently found, that's probably where you heard about it, under a parking lot in Leicester, England, back in 2012. And researchers then did CT scans of his bones and determined that he was not a hunchback. He did not have kyphosis.
Yeah, what he did have was severe right-sided thoracic scoliosis in the mid-back at T8 and T9. Contemporaries had described him as having one shoulder higher than the other. There was also a compensatory curve below that, which pretty much straightened out his spine by the time it got to his pelvis. There were no congenital abnormalities of his vertebral bodies and no evidence of any muscle issues. He would not have had any limp or any breathing issues. His Cobb angle was likely between 70 and 90 degrees. He had classic adolescent idiopathic scoliosis, and his height was probably around 5 feet 6 inches, but would have been about 5 feet 8 inches without the scoliosis, which was the average height for a man at that time. Now, back in the 15th century, they routinely used painful traction for scoliosis, but there's no evidence that he underwent that. So here we have a king with a really severe adolescent idiopathic scoliosis who had 3 children and fought and died on the battlefield with no historical reports of severe deficits or pain.
Okay, you mentioned England, so I have to plug the new Carpool Karaoke with James Corden with Paul McCartney in Liverpool. It was so good, it made me cry. You got to see it, Matt. So good.
Okay, Weepy. Let's discuss surgery versus bracing. Only about 15% of kids initially presenting with scoliosis to orthopedics actually end up having either of these interventions done. So, scoliosis bracing. Rob, do you know who Deenie is?
I know who Deenie is now. Deenie is the main character of a Judy Blume book of the same name from 1973, where the main plot point is that Deenie had to wear her scoliosis brace for 4 years. The book was also famously banned from many libraries because it alluded to female self-stimulation for pleasure multiple times. And obviously, that was way too much for 1973, but that was nothing compared to her much more explicit book, Forever, published 2 years later in 1975 about high school sexuality and also had hints of a gay character and discussed the use of birth control pills. Now, did you read both of those, Matt?
Nope. I had to look up who Judy Blume was.
Okay, well, I think if you heard any of them, her most famous book was the early one in 1970, Are You There, God? It's Me, Margaret, about puberty.
Heard of that.
Yes,
yeah.
And it's awesome. Not to be confused with the 2008 book, Are You There, Vodka? It's Me, Chelsea, by Chelsea Handler.
Nice. How many people do you think got that joke?
Me.
Yeah. Bracing has been used routinely since the 1940s. The main point to be made here is that bracing is not meant to correct scoliotic curvature, but to limit its progression, particularly reduce the risk of severe curve progression over 50 degrees and therefore avoid surgery. So again, bracing is not meant to correct scoliosis. It's meant to limit its progression. It's not helpful once the child is skeletally mature with curves of under 20 degrees or over 50 degrees. The success of bracing is directly related to the number of hours per day that brace is worn. In the early days of bracing, it was often quoted as needing to be worn for 23 hours a day. But now, often the kids are being encouraged to try to wear their brace for at least 18 hours a day. And the braces actually can include monitors that tell the orthopedic team how often they're actually being used. These hours can and are more often individualized for each case. Bracing may not have a tremendous amount of success if the curve is purely a thoracic or upper back curve, or if the child's totally skeletally immature when it's being used, since it helps the most when the child is in the midst of their peak growth velocity. The bracing is mostly used for curves in the 25 to 40 degree range. That seminal paper by Weinstein in 2013 provided the first best evidence that bracing can slow the progression of adolescent idiopathic scoliosis for some patients and allow them to avoid surgery. They used the Boston and the Wilmington braces in that study. It's kind of amazing that it wasn't until 2013 that good and rigorous study was done on this topic.
I know, such a common thing, and that was the first one.
Yeah. The most popular scoliosis brace, which can be hidden under the clothing, is called the Boston brace. This brace is worn under the arms and around the torso. There are other similar underarm braces that are designed to be worn at night, like the Charleston bending brace and the Providence brace, but these can only be used when lying down, and I don't think they're used so much.
They are not. Now, there is one old brace that included the under-chin extension that was really only indicated for double thoracic curves, and that's one you saw on 1980s TV shows.
Oh, yeah.
And with flashbacks of a kid with braces, and it was called the Milwaukee brace, and it's no longer used, but it was the brace worn by Joan Cusack in the movie 16 Candles. And again, these same characters wearing braces also usually were wearing the orthodontic headgear also.
Oh, gosh.
In school.
Oh,
Remember those?
Poor Joan Cusack seems to suffer the indignity of every, suffering character. And speaking of that, wasn't she in the Addams Family, the remake?
I don't know.
I think she was. I think she was going after Uncle Fester. Yeah.
Poor Joan Cusack.
I know.
Although when I think of orthodontic headgear, I think of Jan Brady. from the Brady Bunch. And so you want to hear my Jan Brady impression?
If I must.
Ready? Marsha, Marsha, Marsha.
Ouch.
In general, full-time bracing over 20 hours per day is often preferred when the curve is over 35 degrees or with double curves. Youth and teens greatly prefer when you can get away with just night bracing. Now, that Boston brace is a thoracolumbar sacral orthotic, or TLSO, and it's made from generic prefabricated molds by an orthotist, which is the person who makes these braces and who is very skilled in his craft and uses pads and cutouts specific to a teen's scoliosis curve. Once he makes these measurements and designs the brace, it can be made someplace else and sent to the patient. And that's pretty much how you make a Boston brace. You take the measurements, and then it's made someplace else, and then you get it back and you customize it with pads and such.
Yeah.
But there is one kind of brace that's actually custom built for each individual youth based on a cast that's made of his body, and then incorporates some pads. And it fits like a flak jacket, and it's a full contact TLSO. And you know what this brace is called, Maddie?
Again, let's be
Arnold Horshack.
geocentric. Does it have something to do with Wilmington, Delaware?
The Wilmington, Delaware brace. Now, I think initially the Wilmington brace was not as durable, but that has improved. And most orthopedists either use the Boston brace or the Wilmington brace. Obviously, around here, they like to use the Wilmington brace. Or that European Rigaud Chanot brace, which is becoming more and more popular
I'm
in
impressed
the
you
States.
can pronounce that.
Yep. That's all I got. Being in Quebec,
look
that's
at
all
you.
I can do. Now, all these braces should be worn, again, usually they say up to 18 hours a day, but you hope for at least 13 hours a day. And you brace pretty much until the patient is skeletally mature.
Okay. So what do we have left? Well, we have left scoliosis surgery. This type of surgery is seriously considered for anybody with a 40 to 49 degree curve and who is still skeletally immature, and for anyone above a 50 degree curve. Once teens have stopped growing, the scoliosis can still progress by about 1 degree per year. So, after 30 years, there may be an 80 degree curve. Some say that this degree of curvature can compromise lung function, but others disagree, perhaps including Richard III. If the scoliosis tops out around 35 degrees or so, it's unlikely that it will worsen later on in life. In the really early days, scoliosis was often treated without instrumentation, with months and months spent in plaster casts. The more significant curves, unfortunately, progressed anyway. The most common surgical treatment now is spinal fusion, either anteriorly, meaning from a frontal approach, or posteriorly, from the back. These procedures include bone grafting and instrumentation. These days, the orthopedic surgeon does not have to wait until the patient is completely skeletally mature to do the surgery, as was the case in the past. It's worth noting that with any fusion of bone, there will be, by definition, the loss of some mobility. Posterior spinal fusion is by far the most common method. It used to be done with stainless steel rods, which were sometimes called Harrington rods, which were in use from the 1960s to the late 1990s. These rods tended to over-straighten the lower lumbar back and cause a loss of normal curve, lordosis. This was called flat back condition or flat back syndrome and often caused pain. Do you remember that, Rob?
Oh, I remember those Harrington rods and caring for those kids in the PICU post-surgery.
Brutal. I felt so bad for them.
The blood transfusions and the factor transfusions.
Don't you remember like they were supposedly lost, like, I don't know how, like what times their body, of blood during these it was brutal. But anyway, now the orthopedists often use segmental stabilization with a variety of hooks and screws and wires. This technique is better able to control spinal rotation and often allows the teen to start to walk as soon as the day after surgery without a full body cast, and this is awesome.
It is.
These techniques preserve lumbar lordosis. There are some rods used that can be magnetically lengthened to avoid follow-up open surgical lengthening as the child grows. The results are oftentimes nothing short of amazing. Just incredible. And the child's home in like 5 days.
And everyone's really happy.
Oh my gosh.
It is miraculous what they do. Hats off, pediatric orthopedic surgeons. It's
big
amazing.
ups.
Now, anterior spinal fusions are more for scoliosis of the lower back and for some tricky upper back curves. And often this surgical approach can go through the retroperitoneum or through the thorax with a thoracoscopy. There's less risk of blood loss and often less risk of neurologic complications, but it's much more complex and challenging, and pretty much posterior spinal fusion is the way to go in most cases. Now, the holy grail of scoliosis surgery is correcting the deformity without having to fuse the bones of the spine. One promising method, which is being used today, is vertebral body tethering, or VBT. Our local children's hospitals is doing this some, and it's exciting for the future. Any spinal surgery for scoliosis, there's complications of blood loss, infection, neurologic injury, but all of these have gone way down in the past 25 years to well less than 1%. It's rare these days to get a blood transfusion. Again, that's incredibly different than the old days when it seemed like we were replacing all their blood routinely, as well as giving blood products to limit bleeding.
These patients, who are mostly adolescents, are back to regular activity in 4 to 12 months, on average of 6 months, and we see them back to all of their sports except for maybe contact sports like football, hockey, or rugby. Some orthopedic surgeons will even let their patients return to high-level contact sports like college football.
Right, so it's really variable. I mean, I'm always surprised when they let them go back.
Yeah, astounding.
If I was the parent, I would worry about that. Doing all this surgery, I'm not sure I'd let my child do that.
I'm with you there, man. There is some decrease in range of motion due to spinal fusion, so in some sports, like gymnastics and dancing, the patient will likely not get back to their previous level. After their initial follow-up visits, these surgical patients only need to be seen in a couple of years. They rarely will need any follow-up x-ray, and usually no adult follow-up is necessary. The lack of the need for adult follow-up is also the case for skeletally mature adolescents who did not require surgery with scoliosis of under 40 degrees. If the patient's curve is 40 to 49 degrees and they are skeletally mature, then it's possible that the curve can progress. These patients need to be seen every 1 to 2 years. Pregnancy does not affect curve progression, and scoliosis does not affect pregnancy outcome in women who have had scoliosis surgery. There's no increased risk with a pregnancy or a need to deliver by C-section if a woman has had scoliosis surgery.
Okay, Matty Ice, that is it for scoliosis. We'll be taking a break to attend Hot Topics in Pediatrics at Disney World and giving our listeners some highlights of that conference in our next few episodes, including the hot controversy debate on whether a parent should allow their child to play tackle football at all because of concussion risk, and whether we pediatricians should be strictly following the lipid screening guidelines for all healthy 12 and about 18-year-olds with no risk factors. Matt, do you follow these guidelines religiously?
Nope.
Neither do I, but we'll be talking about it. Okay, Matt, say goodnight.
Good night, Rob.
Good night, Moon.
Later.
Bye.
Here's the story of a lovely lady who was bringing up 3 very lovely girls. All of them had hair of gold, like their mother, the youngest one in curls. It's the story of a man named Brady who was busy with 3 boys of his own. They were 4 men living all together, yet they were all
Podcast Pediatricians Productions. All rights reserved.